I was always fascinated by science, and I read everything I could about all different types of science, geology, astronomy, etc. But I was particularly fascinated with the human body. And I will say one of the things that got me really interested in medicine was that my father had a lot of health problems, and he was in the hospital quite a lot. And I saw firsthand the effect that the doctors and nurses had on him in getting him better. And my dad had such an incredible respect for the healthcare providers. So I always carried that with me, and then really from an early age he was saying, well, I think you should go into medicine. So I have to say I don't always take his advice, didn't always take it, but in this case I did. I thought it was a good choice. In infectious diseases, you saw the whole gamut. You had patients who had heart infections, you had patients who had kidney infections, brain infections, and then there were the really interesting things of patients who had fevers or illnesses that no one could figure out, and so they would come to you. And then you would have patients who had traveled all over the world or come from other parts of the world and they had somewhat exotic illnesses. So I just found that very fascinating. I certainly enjoy the intellectual aspects of figuring things out, but what I really like is making patients better. So to me, the most satisfying thing is to see somebody who was very, very sick and perhaps had a long struggle to get better, and you help them along that road, and then you see them a few months later and they're back to their usual activities. To me, that's probably the most rewarding thing.